Are you worried about losing penile length as you age? Is it true that penises are shrinking? And what can you do about it? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today I'm going to talk about how your penis changes in length as you age. If you're new here, I am a urologist and I talk about all things urology on this channel, things that can improve your health, your sex life, and much, much more. If you like what you see here, make sure you subscribe and hit that notification bell so you don't miss my new videos each and every week. First off, when you are looking at your own genitalia, you may say, hey, it definitely looks smaller today than it did the last time. And the reason being is that the actual length of the penis can change based on a number of different factors. That can include how warm the room is where you're measuring, how erect you are, and maybe even how much stress is going on in your head at the time. And technically, when urologists measure penile length, we measure it in the same way each and every time. Typically, the guidelines are to measure it in a flaccid state at a stretched length and doing it in a warm room. So how exactly do you do that? Well, the easiest way is to lie down, take the glands of your penis and stretch it out, and take a ruler and measure it from the base or the bone, the pubic bone that you feel there, to the tip of the penis. So there's 4 major reasons that can cause you to lose length as you age. The number one reason that most people think that their penis is actually shrinking when it's truly not is because they've gained some weight. Specifically, they've gained weight that makes it harder to see the entire length of the penis. So if you lose weight, you can actually see more of your penis and feel like you have increased your penile length. The second reason is very often prostate removal. So if you've had surgery for getting your prostate removed for prostate cancer, then you may often notice that you can have a shortening of your penile length. And that can range anywhere from 1/2 inch to 3/4 of an inch. And occasionally that can come back over time, but that does happen very commonly after prostate surgery. The third reason is something called Peyronie's disease. And I've made a video about Peyronie's disease and what are the options to treat it, but essentially what it is when you have a plaque buildup on your penis, which can cause the penis to curve or change into a different shape, like an hourglass. And you will notice it because you will see a noticeable lump on your penis, or you may see that your penis is bending or curving in a different way. And lastly, there are certain things that can cause what we call corporal fibrosis, or make the penis actually lose blood flow and have less robust blood flow, which can cause erections to be less strong and hard over time. And these can be medical problems like hypertension, diabetes, heart disease, and sometimes having issues with erections might be the first sign of a medical problem like the ones I described. And sometimes over many, many years, you can have micro traumas or small injuries to the penis due to sports or vigorous sexual activities that can create these micro fractures that can then cause this corporal fibrosis. So what can you do to help prevent penile shrinkage? Well, the first and most important thing is making sure to maintain a healthy lifestyle. So eat healthy, exercise, and keep any excess weight off. Make sure you see your primary doctor regularly to get your cholesterol checked and get your screening for prediabetes if you are at risk for it. And lastly, if you're suffering from issues like erectile dysfunction where you're having difficulty getting an erection that's firm enough for penetrative intercourse, it's important that you try to see a urologist or a primary care doctor to get evaluated, because actually getting erections increases blood flow to the penis and can help keep your normal penile length. Generally speaking, if you're super healthy, take really great care of yourself, you can still see a little bit of shrinkage. It's usually 1/2 inch or less, just due to the changes in your body composition and your tissue elasticity, which can happen to everybody. All right, thank you so much for watching. Remember to share this video with your friends if you think it'd be useful. And as always, remember to take care of yourself because you're worth it.